I'm presenting our network meta-analysis titled Comparative: Efficacy of Regional Analgesic Interventions in Open versus Laparoscopic Hepatic. Let's begin by understanding why this study matters. Despite advances in surgical techniques, 35 to 52% of patients still experience moderate to severe pain following liver resection. Existing trials report heterogeneous outcomes, and procedural heterogeneity complicates the establishment of consensus, while guidelines like Prospect provide recommendations for open hepatectomy. The optimal regional technique, especially in the increasingly prevalent laparoscopic approach, remains underexplored. This uncertainty directly impacts clinical decision-making and patient outcomes. To address this gap, we conducted a comprehensive network meta-analysis. We focused on regional analgesic techniques, including thoracic perivertebral block, transversus abdominis plane block, erector spiny plane block, quadratus lumborum block, thoracic epidural analgesia, and intrathecal morphine. Our study adhered strictly to PRISMA-ENMA guidelines and was registered with Prospero from 835 initial records and ultimately included 23 randomized controlled trials comprising 382 patients. The mean age was approximately 51 years, with an even distribution between intervention and control groups. Risk of bias assessment using the Cochrane ROB2 tool revealed that most studies demonstrated low risk in randomization processes and follow-up completeness. The network geometry was well connected across all outcomes, with 9 comparisons for pain scores, 11 for opioid consumption, and 8 for PON value, enabling robust direct and indirect comparisons. However, and this is crucial, no statistically significant differences were found among the active interventions themselves in network comparisons for either pain scores or opioid consumption. In open hepatectomy, which typically involves right subcostal or L-shaped incisions with extensive somatic trauma, erector spiny plane block emerged as the most favorable intervention. This suggests SP effectively addresses the significant somatic pain component in open procedures. Conversely, in laparoscopic hepatectomy, intrathecal morphine dominated the efficacy for pain scores and opioid consumption. In conclusion, regional analgesia unequivocally provides opioid-sparing benefits after hepatic resection compared to conventional systemic analgesia. However, no single technique demonstrates universal superiority. Ultimately, technique selection must be individualized based on institutional resources, patient-specific factors, anesthetic risk, and surgical stress. Thank you for your attention. I'm happy to take questions.